Thank you. Thank you very much, Dr. Beng Yong and Adrian Lau. Thank you for inviting me. The Rainbow Center you can see in the background of this slide. Can you see the slide?
Yeah, we can.
Okay. I'm going to focus on the diagnostic challenges. I learned things the hard way. I was sort of shoved into this area by Professor Frida Paul at the National University when she was retiring, and then I just had to learn from scratch. And so most of my knowledge is from practical experience, interacting with patients, making mistakes. We all make mistakes, but over the years, I've sort of tried to fine tune and try to look at some of the difficulties and some of the challenges that we faced. First of all, no disclosures. I'm not attached to any pharmaceutical company or any other organization other than the Rainbow Center. And I'm going to talk about these areas, the clinical features, diagnostic criteria, and the controversies, prevalence, imaging, genetics, management, and the future. So those are my talks. The way that a lot of the patients that come to see me, usually it's either from the parents who are worried or the teachers who are worried, and quite a number of them have speech delay. And one of the interesting facets of this speech delay is that sometimes they have a little bit of speech and then they regress, they stop speaking. And that is quite a unique feature of autism, this regression in speech. The other things that they present with is the repetitive behaviors that parents initially may find it quite fun, quite interesting. But after a while, when they do this too often, then they get a bit worried. So they either flap hands or clap, or they line things up, or they draw repetitive, or they spin objects. And so, or they jump up and down like this. And so parents get a bit worried, and so do the teachers in the classroom. Other repetitive movements, like this boy who is he's making noises like noises, and he is also moving his legs and his arms and then swinging back and forwards. So these are some of the repetitive movements. And the other thing that I often encounter is this echolalia, where they learn to speak, but then they repeat the words. So I ask them, what's your name? And they'll answer, what's your name? How old are you? How old are you? Initially, a lot of young kids, when they are starting to talk, they may also have a bit of echolalia. And this is normal for normal children. But if it persists beyond a few years, then this is viewed as abnormal. Other things that the kids often, when they come to see me, they cover their ears because they don't like noise. Anything noisy, they don't like. Or they cover their eyes because they also don't like bright lights. And the difficulty in socializing is one of the problems, but it is also quite difficult because how do you differentiate that from shyness? A number of kids are shy because they don't like to see doctors, for one. They feel that every time they see a doctor, they get a needle. So, and also they may be in a new school, new classroom with too many other children, and so they feel a bit shy. So how do we differentiate shyness from the poor socializing? The other feature I noticed is the failure to understand what your facial expression. So sometimes when the parents scold them, you know you're naughty, they laugh. They think that it's a joke. Then the other abnormal behaviors like throwing things or meltdowns, temper tantrums, these are quite a common way of presenting. Professor Simon Baron-Cohen, the professor at Cambridge University, was one of the first people to say that pointing is absent in a lot of children. autism. The thing is that he had this theory that the reason why they don't point is because of the theory of mind. In order to understand another person's behavior and response, you have to be able to understand what they are thinking. So the failure to understand is how he explains the failure to point, because if you're pointing, you need to convey this action to someone else. So they have to understand that pointing is for you to convey that you want them to look at what they're pointing at. And so this failure to point is one of the features of autism. So I started writing a book on autism. In fact, we are celebrating the 35th anniversary of the Rainbow Center this next week. And so when I wrote a book about autism, I was immediately criticized by the British. They said that the Diagnostic and Statistical Manual of the American Psychiatric Association is not a diagnosis, despite the name Diagnostic. It is not a diagnosis. Same with the International Classification of Disease, the ICD. They criticized me, saying that these are not diagnoses. They're too vague. They are more like classifications to point you in the direction of autism. To be able to diagnose autism, you need a much more thorough, a much more detailed and investigated approach, which these following categories: autism diagnostic interview, autism diagnostic observation schedule, the ADOS, the MCHAT, the CARS, and the GARS. These are the mechanisms, the ways of diagnosing autism. So these are the ways that most psychologists will use to diagnose. So the original diagnostic triad included poor social interaction, impaired verbal and nonverbal communication, and restrictive, repetitive, stereotype behaviors. And this was changed in the DSM-5, the most recent change in the Diagnostic Statistical Manual, which is not diagnostic, is that they, instead of having 3 separate categories, they merged it into 2. So you have this poor social communication and restrictive, repetitive, fixated in behaviors. So the controversy now is, do we have a right to make a diagnosis? Is autism a disorder or is it a difference? The many diagnostic difficulties, and I'll go through them in a minute, some causes, management, and adult support. So what is the difference between a disorder and a difference? Well, a disorder is abnormal. A difference is normal, but different. So the question is, do we regard autism as a disorder, a medical condition, or a psychiatric condition, or is it just a variation of normal? And what is normal? So we have to use the standard bell curve to diagnose normal. So normal is a statistical definition. It's 2 standard deviations from the mean. Why 2 standard deviation? Why not 1.9 or 2.1? This is all due to the statisticians putting their foot down and saying that it is 2 standard deviations, and we have to abide by statisticians. So autism, if you look at the 2 standard deviations, would probably account for about 2% or less of the population. The other problem is that autism is a spectrum. There are mild, moderate, and severe. We used to you used to have a separate category for mild. We call them Asperger, but this has now been discarded. So now we use the term mild, moderate, or severe. But because it is a spectrum, there's no clear point dividing line, because what is normal and what is abnormal, there's no clear division. Kenneth and Asperger were some of the early describers and initiators of autism. Kenneth was very definitive but very severe. So he said that autistic people had zero speech, zero social interaction, and very severe repetitive movements. Whereas Hans Asperger had a milder form in which there was some speech, there was some socializing, and there were less of the severe repetitive behaviors. The problem arose from the milder end, the high-functioning people. They did not want to be called autistic. They didn't want the label. They wanted to be called different, but within the normal spectrum. They can still receive help, tuition, etc. But what they want is more understanding and inclusivity. Now, I try not to be on any particular side, but because we as doctors and psychiatrists, we see more of the severe form, I think no choice. We have to err on the
王
side.
小华也在里面呢。
Sorry. We want to make a differentiation. And so this is, I err on the side of being on the medical side, which says that, yes, autism is a problem. It is a diagnosis. And so we need to know when to intervene. So we intervene when kids have difficulty communicating, like speech therapy and so on. They have difficulty socializing. We want to try to get them to interact with other people. And some of the autistic kids I have dealt with can't even do simple things like dressing and feeding themselves, taking public transport, shopping, getting a job, etc. So I think no choice, we do need to intervene. And the problem is that we need a lot of help, and the help may require special schools, special teachers, special speech therapists, and so they cost money. And because we are limited in the number of speech therapists, number of teachers, we have to be able to choose the more severe. The other thing about autism is the symptoms. They change over time. Yes, they do. And some improve and some may develop other behavioral problems which are not initially noted, like freezing. They sometimes stand for hours on end, just stand in the toilet or in front of a door, and they may develop even more obsessional compulsive behaviors as they get older. What is the incidence or what is the prevalence in Singapore? Well, we think it's about 1 in 150, which is very close to what the WHO, the World Health Organization, says roughly 1 in 160. And if you look at the world's prevalence, USA seems to have the highest prevalence. Now, we think the reason is because in America, you can get special services like special education and speech therapy provided or subsidized by the government if you have a label, if you have a diagnosis. And so many people are more willing to label the kid as having autism. So you can see the American is far, far higher, 10 times higher than Hong Kong, Japan, and even more high than Singapore. If we look at the prevalence over the past decades, there has been a vast increase, several-fold increase. And this cannot be genetic because it's too short a time period. And we think maybe the reason is people are now becoming more aware of the possibility of autism, and so they are referring for diagnosis earlier. And because of that, the pickup rate is much higher. The comorbidities are also very common in autism. The attention deficit hyperactivity disorder, ADHD, epilepsy, genetic disorders, intellectual disability, between 15 to 40%, 30%. So they're quite common, these associated comorbidities. But are we overdiagnosing? I think so. I have a feeling that we are becoming a little bit too free in our diagnosis. Because one, there's no definitive diagnostic test. I cannot take your blood for, let's say, sodium, potassium, or hemoglobin. There's no definitive test. Also, the diagnostic tests are not 100% reliable because we are asking, are you sociable? But what is the definition of sociable? And, you may be sociable on Monday and Tuesday, but not sociable on Wednesday. So it all depends which day you're tested and also where you're tested, because sometimes if you're tested in a very nice environment, you do better. If you're tested in a hostile environment, you do worse. Then the age and environmental changes in behavior. If you are too young, you cannot diagnose. And a lot of people are not diagnosed till many years, many decades later. And of course, the diagnosis is much harder as you get older. And then to receive government help, as I said, we tend to over-diagnose, to give a label in order to get into that special school, to get speech therapy, to get any government handouts. And then the comorbidities will also cloud the diagnosis. For example, attention deficit. A lot of kids who see me were referred to me because of attention deficit. They don't pay attention, they can't sit still, they're moving around all the time. And because of that, the poor socializing is often missed. And so they have attention deficit. They're diagnosed as attention deficit, but they do not get better with any of the treatment for attention deficit. And then only when the attention deficit gets less and less as you get older, then the autistic features become more prominent. So these comorbidities cloud the diagnosis. The differential diagnosis, there are many, many differential diagnoses. This is only a partial list, like a developmental delay, because a lot of the autistic kids can't talk very much. They have learning difficulties. They sometimes have problems. And then on the other end of the spectrum, I also have the gifted kid, the kid who is not paying attention in class, who is just keeping quiet. And he's very gifted. They're very, very talented. They are brilliant, absolutely brilliant, but they are labeled as autistic because they are not interacting with other people. They're not talking very much. They are just sort of focused on what they are doing. The shyness, a lot of us are a bit shy. We don't like to mix with other people. So how do we know the difference? What is the difference between shyness and autism? Because they both have this problem with socializing. And I guess the shyness may also be dependent on where you are. Some children are shy at school, but at home they're really, really very, very friendly and they love everyone. So it could be the environment that causes them to be shy, or maybe they are a bit afraid of the teacher. They may get scolded. So there are many reasons why some children are shy. But shyness is a temporary phenomenon. They'll grow out of it, whereas autism tend not to. That anxiety, what is anxiety? This is extremely difficult to pinpoint. And then the language disorder, the different types of language disorders, the dyslexic type of language disorder, inability to learn a different language, especially if they speak one language at home and a different language at school, they may have problems with communication. Hearing impairment, I've missed a few cases of hearing impairments, and now I make it a point to check the hearing very carefully. Attention deficit hyperactivity, obsessional compulsive disorder, social communication disorder, and other genetic disorders like the Tourette syndrome. So these are some of the differential diagnoses. The hearing assessment is one of the investigations that I've now become more willing to do at an earlier stage. I also do the thyroid function because quite a number of the autistic kids actually do have a thyroid problem. To my surprise, I didn't expect it, but when I test it, then they are hypothyroid. The IQ test may be useful, especially if they are very high functioning, very brilliant, talented, but also it can be useful even if they are not doing very well, they have slow learning problems. So the psychological assessment will assess for attention deficit and other problems. The other investigations we do are imaging, EEG, and genetic testing. Now, they are not that useful, and there are a lot of papers on this, on MRI scan, functional MRI scans. And yes, there is a difference between the autistic individual versus the normal neurotypical. So this, for example, is a fMRI scan showing that in a normal person, non-autistic, there's a lot more action. The functional MRI scan looks at blood flow and oxygen utilization. And you can see there's a lot more red oxygen utilization on the left side, whereas the autistic kid on the right side has relatively less function in the brain. This is a real-time function. The other test that we can do is the electroencephalogram EEG, and this is also abnormal. And there are lots of papers to say, yes, there is a difference between the EEG in autistic and non-autistic. Yes, it is significant, but the problem is that there's an overlap, and makes it almost impossible to use this as the definitive diagnosis. So the conclusion for almost all the papers is, no, do not use it as a diagnostic test. The twin studies are also quite interesting because we now believe that autism has a genetic component. So the twin studies, there are thousands and thousands of identical and non-identical twins. They found that the identical twin concordance rate is very high, it's 77%, versus the non-identical twin, which is only 30%, and the general population of 0.6%. Now, because it is only 77%, that means there's 23% of other factors. And these other factors may be environmental, like parental age or gestational diabetes or something else. We don't know. It's still a woolly area. We're still researching into it. But the other problem with the genetics, now that we got a Human Genome Project, we can actually map out all our genes. Every single gene can now be established. And yes, there are some links. And so we are very excited by these links, but then the disappointment. The problem is this. Yes, we can find an abnormal gene in this family. Family A has abnormal gene A. The family B has abnormal gene B, which is abnormal, and C, D, E, F, G. And so there are now it's over, last time it was 65, now it's over 100 at-risk genes. And we still don't know. There's no gene that crosses from one family to another family. And this is where we are at the moment. So we hope that maybe one day we'll be able to find something that crosses over. The thing that has been highlighted in the past decade was the MMR vaccine. And we now know there's a lot of data and a lot of studies. Every study showing that there is no relationship between the MMR vaccine and the causing of autism. The original Kenneth said that it was bad parenting that causes it, the refrigerator mother. And Bruno Bettelheim propagated that even further. But now we know it's nothing to do with how mothers treat. Yes, mothers can sometimes be a bit disappointed. I've seen mothers who, when they have a difficult child, and the child is crying or not doing things, you ask them to eat, they refuse to eat. Of course, mothers get a bit upset. We all get a bit upset when the kid is misbehaving. So what are the challenges? What are the challenges that families face? One is coming to terms with the diagnosis. A lot of times when I say, I think your child may have some features of autism, they absolutely reject it. They say, no, they think that I'm wrong. So they are very, very adamant in saying that, no, I'm wrong. But I try to slowly convince them that even if I may be wrong, it's still worth having some speech therapy and some way of dealing with these kids who are misbehaving. So yes, I tell them that my diagnosis can be wrong. I'm not perfect, but let's deal with the problem. If it's speech delay or some problem socializing, let's deal with that problem. then we have to deal with other family members. Other family members may also be very, very difficult to deal with. Now, the reason why I think that we are overdiagnosing, because you look at all these people, they've all been labeled as autistic. And even Elon Musk confessed that he is Asperger. So you look at all these people, Einstein, Newton, Charles Darwin, and so on. These are very famous people. And maybe some of the features of autism is that they are very concentrated. They are able to narrow their focus so that they can make brilliant discoveries. So they have to be, to make a lot of brilliant ideas, you have to be quite focused. So Satoshi Tajiri, also one of the Pokemon creator, has also been labeled as autistic. So we really, really overdoing it, I think. So how do we treat it? Now, currently, we're using education as a means. And we try to incorporate all the different elements. And we have behavioral intervention. Medicines are only useful if they are really, really hyperactive and becoming totally difficult to manage. So this was the school I started, the Rainbow Center, 35 years ago. We're celebrating next week, the 35th anniversary. What we do is we're quite lucky. We had Vera Bernard, who had a PhD in the treatment of autism. So she was in Singapore, and so I quickly roped her in, and she started the program for us. What she said was that she would use behavioral therapy, and immediately I shuddered. I said, "Oh my God, this is Pavlov and his dogs. Are we going to make the dogs salivate and give them meals?" No. So she modified it. So she modified the behavioral therapy. So it is more to encourage them to do things like speak and socialize. So speech therapy became one of our major ways of helping. Social development, we have these classes where there are few people, they try to do things together. So we have some group activities. Occupational therapy, I always thought that occupational therapy was trying to get you a job, an occupation, but now I sort of realize it's really to try to develop your skills. So it includes a bit of everything. It includes a bit of physiotherapy, bits of how to do things and how to manage things. So this is what occupational therapy is about. We also use physiotherapy to help them to maneuver, to run around, to do things. And the other therapies we employ are art therapy. I found that art therapy is very good to not only to get them to express themselves, but also to train their hands. Music therapy, in fact, I was quite surprised that a lot of the teachers and a lot of the therapists in autism said music therapy is a waste of time. But I'm a musician, so I felt that no, there must be something about music. So I introduced it, much to everybody's, they did not want it. They thought I was wasting money, but I introduced it anyway. And over the decades, there have been a lot more publications saying that, yes, music therapy does help. It does help in speech, it does help in socializing, it helps in calming kids and the parents down. So it does help. So I'm very gratified that music therapy is beneficial. So we do use it. So we do all these things. We have arts and crafts, we have music, we teach them things like baking and building things, gardening, all these things we are now using. We're using a multidisciplinary approach. So we also teach them swimming and rowing, climbing. All these things are available. So we have a pool in our school, we have a gym, we have a climbing place in the school, and then we take them out. We take them out for walks and for visiting the gardens by the bay and the museums. So we go all over the place. then the employment. As they get older, we need to do something with their employment. Now, it so happens that the Professor Braun Cafe was actually started by the parents of a child with autism. And now it's moved to Raffles Institution. It used to be here, so it's moved. We also use teaching them how to make coffee, how to do gardening and other things, and shopping. And so we now believe in the inclusivity. So we had President Halima Yousaf visit our school, and so she has been very helpful, and so has Lee Hsien Long, whose eldest son also has a bit of autism. So we are now trying to get help, but also to widen help to include everyone. So we are very inclusive in our philosophy, in our management. We even got a visit from the Duke and Duchess of Cambridge, who may one day become the King and Queen of England. So that's all I'm going to say for the time being. Any questions?
Yeah. Dr. Lyen,
Yes.
Lyen. Do mothers taking medication, especially antidepressants during pregnancy, are they at risk for the child having autism? Because a lot of patients have been asking me.
Yeah, the answer is, well, we don't know. We really don't know. There have been so many of these medicines that mothers take nowadays, and the question is it due to the medicine or is it just coincidental? And I think the answer is still not available.
Okay.
We really don't know.
Okay, thank you.
Yeah, some of the patients initially diagnosed with ASD, then when they become older, the diagnosis turned out to be ADHD. Are you surprised with that?
Yes, we have had one or two cases like that were misdiagnosed, and they had attention deficit all along, but they were sort of hidden out of sight, and so because of their poor socializing or repetitive behaviors, we misdiagnosed them. So it has happened. We do misdiagnose, and it is one of the problems in the diagnosis. But luckily, over the years, I think it's become less and less. And we have also made it more vague, our diagnosis. I now say it could be autism. So we are not definitely wrong. We are partially wrong.
Okay. Yeah. Any more questions from the rest in the group? Anyone else? Any questions for Dr. Lyen? Okay, then, if not, it gives me a great pleasure to thank Dr. Lyen. Thank you very much for that great informative talk. Thank you. Thank you.
Thank you. And if you have time, please.
And I've sent you all the connection on where to get this book from. You can order it online. Yeah, Dr. Lyen, I'm sure you get a lot of support from us.
Thank you very much.
Bye-bye.
Thank you.
Bye-bye.
Bye.
Bye.